let me first ask what the state of the pandemic is. I know we had a reading of 400,000 new infections just a couple of days ago. It's come down a bit, but not enough. Is India headed in the right direction, or is it getting worse?
Yes, it's a grim situation. 1 in every 2 cases in the world is being reported out of India now. Of course, India with its vast population, the numbers are always high. But what is also worrying is that the test positivity rate is also increasing. So it's about 20% nationally, and it's over 30% in many states. This actually means that many people probably have the infection and are not being diagnosed or detected because despite scaling up testing considerably, it's still not enough to capture all the infected people. So the numbers, while very high, are likely an underestimate of the true numbers of infections. The priority just now is really to ensure that people who are infected get adequate care, that they're properly managed and monitored, that those who need a hospital bed, especially with oxygen or other forms of ventilation, get access to that, and that those who can be managed at home or in community isolation centers or care centers can be managed at home. The scale is enormous.
The concern, doctor, is that that's not happening. The concern is that that's not happening, right? I mean, it's proving incredibly difficult, even for people who have previously had privileges, to get that kind of access at hospitals, to get on ventilators, to get oxygen. What can be done in order to meet this crisis?
Yes, the oxygen supply increased suddenly, and, big cities like Delhi were caught unawares. I think there's a huge effort going on now to make sure that the oxygen that's being produced in factories around India can be transported easily. There's a lot of international help that's gone in transporting both large-scale oxygen concentrators that can be set up in hospitals and care centers, as well as the internal coordination, I think, is improving. So we should see, hopefully, in the next few days, an alleviation of the problem of oxygen supply. But yes, health systems have been strained. Doctors and nurses are working, non-stop, and the shortage of supplies is making it difficult. But I think the problems have been identified, are being dealt with. WHO is also helping to set up mobile hospitals, as are other agencies that are working, so that people can be triaged and taken care of at different levels where they get medical care, but they don't necessarily have to all crowd into the tertiary hospitals.
When do you expect infections to peak, or where?
Well, it's very hard to predict. It's a heterogeneous epidemic in India because it's such a huge country, and we've seen that the peak in the western states like Maharashtra has actually flattened over the last week or so because it started earlier. But we still have large parts of the country with susceptible populations, people who do not have immunity against this virus, where it could spread. So it again depends on the actions that are taken now in terms of implementing stricter control measures for people's movement, to prevent gatherings, to really cut down on people being able to mix with each other. And there are about 200 or so districts where the test positivity rate is already over 10%. And I think we need to focus really on those districts and bring in some strict measures to prevent the virus from being able to transmit from one person to the other. Because on the one hand, we have to take care of those who are already infected, but we also need to turn off the tap so that new infections are reduced considerably.
What can India do? You've talked to us about what needs to be done in terms of immediate steps, but what about longer term to prevent future health crises like this?
Unfortunately, yes, many countries have learned, a painful lesson that when this epidemic starts increasing exponentially, it's just absolutely difficult to cope. We've seen this in country after country over the last 16 or 17 months. So I think they need to do a few things. One, of course, is going to be the focus on ramping up vaccination, and that is already happening. across the country. The bottleneck there is the supplies. If there were more supplies, then India has the capacity actually to vaccinate many more people significantly. There's a large network of there's a very good immunization program. There's also a large network of private centers and hospitals that have pitched in. And so vaccination could be scaled up if India got hold of more vaccines at this point of time. Like the rest of the world, we're all facing the supply-demand problem here for vaccines. The other thing, of course, in the longer term is to strengthen health systems, both in terms of human resources, in terms of infrastructure and resilience, in terms of being able to monitor and predict by surveillance, what's coming down the line and take early action, setting up public health cadres in every state. There are a few states in India that have a specialized public health cadre, but this should be the case everywhere with epidemiologists at the district level and people who can understand, what outbreaks look like and what needs to be done.
Doctor, are there risks that other developing nations who look to have escaped a first wave could see similar crises, similar jumps in infections and these tragic, horrendous, overflows of the healthcare system, for example, in Africa?
Yes, there's always the risk because the virus is everywhere and it's just waiting for the right conditions to start, increasing its footprint and growing in the population.
But where are your biggest concerns?
Well, concern is everywhere, but I would say biggest concerns are really in the countries which have very rudimentary health systems and which cannot cope. So large parts of Africa, but also countries in Latin America where we have seen terrible scenes, being played out. In Africa so far, it has been sort of under control. But I would say that the data on cases and deaths from many, many countries is just not robust enough. So we cannot just go by the reported numbers. When sero surveys have been done, when post-mortem studies have been done, the actual number of infections in the population have been found to be much higher than the cases reported. So I think Africa really needs to take action now to prevent what's happening in India. And for example, one of our focus areas now is oxygen. We have an oxygen task force that's been created globally with lots of partners where we're really saying that this is a life-saving medicine and there's a shortage in many countries. And if we can focus on just that one thing, getting enough oxygen, training healthcare workers how to use it appropriately, that can save lives, not just from COVID, but also from pneumonia that still kills, huge numbers of adults and children worldwide.